Yeah, so you were talking about meniscus injuries, and obviously, I'm between you two. I'm kind of like the lay person here as far as the in this kind of stuff. But I'm curious because I get probably one of the most common questions I get from people that are training and grappling is that they kind of tweak their meniscus in some fashion. With you, with your experience with meniscus tears and things like that, like what's kind of the is there a point where you can do something regenerative wise with it, like with some treatment, or is there a point where there simply is nothing left and you have to either repair it or shave it down or operate on it?
It depends on the pattern. It depends on the rip or the tear pattern. So it's important to get an MRI to look at it and try to define the configuration of the tear. So there's certain tears complex tears where basically it's torn and kind of shredded up, shredded up into like little tiny little pieces. Yes, it's uncomfortable, and yes, it'll be difficult to train initially, but you might be able to get through that without surgery, especially if they have a little bit of age-related or activity-related degeneration. So that's one thing that's been changing over time is, how effective is shaving a meniscus tear when it's complex, meaning a lot of little pieces, and when there's a little bit of age-related arthritis. Because if you can get them through the storm by bracing, therapy, activity modification, PRP for the degeneration, they might be able to then get back to pretty close to baseline over time. That's of course with that particular pattern. If you have a tear where the piece has flipped, maybe the meniscus has just like turned on itself and it's not going back. Those are best treated by just trimming that little piece. It's not going to do well over time probably. And then of course you have other tears. Just to go back to the importance of looking at your MRI. That's what I mean by understanding the tear configuration. The surgeon should look at the images and try to figure out the pattern because it can provide good prognostic information. So if someone's just looking at a paper that says posterior horn meniscus tear, that doesn't mean anything to me. That literally means nothing. You got to look at the images and determine, are we talking about a complex tear? Are we talking about longitudinal tear? Are we talking about root tear? Are we talking about a flap tear, parrot beak tear? So much that can involve that area. So what I would say to your guys, Chewy, is this: make sure that whoever is seeing you has looked at the images. And if they have no interest in looking at their images, then maybe they should get a second opinion, because you got to look at the images. You got to know what's going. You got to know what you're dealing with, and so that's number one. Number two is if it's something that's really out of place, then it may not be worth waiting too long and just going in and trying to do surgery. So then the next question is, what kind of surgery are we talking about? The trimming or repair? I do everything possible to preserve meniscus, because meniscus is your shock absorber. And if you remove it, even if you remove the little torn pieces, sometimes you remove a little bit of the normal tissue to feather the edges. There is information that shows, or scientific information that shows, sometimes even with surgery, they might develop arthritis a little sooner than if they had not had surgery. So you gotta, so you want to repair as much as possible, repair when you can. So that means that the surgeon needs to be agile at repairing, and not give up, and try to repair if it looks like it's repairable. And as long as the patient knows, hey, look, repair doesn't mean automatic fix or automatic heal. It means that they have to baby their leg a little bit, their knee, to allow the healing to happen. So, as far as meniscus tears go, they're not so easy to treat. You have to know what you're dealing with, and then if you do surgery, you need to make sure that you try to repair where you can. And if you can try to not do surgery, then maybe regenerative injections can help. But they're they're not magic bullets, to be quite honest. They're not magic bullets. I mean, they're good. PRP or regenerative treatment is good when there's a little bit of degeneration.